welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Here is what I bring to you all from the world of medicine. Reduced use of child sexual abuse material after online CBT. Researchers at the Karolinska Institute in Sweden have conducted a pioneering study analyzing the internet-delivered anonymous cognitive behavioral therapy, that is the CBT program, for people who view images or videos of children being sexually abused. The participants, who were mainly recruited via forums on the encrypted part of the internet called the darknet, reported less use of such material after their therapy. The study that I'm talking about is published in the journal Internet Interventions. The spread of images and videos of children being sexually abused has been a widespread problem. Now, in 2021, almost 85 million files suspected to contain documented sexual abuse of children, legally referred to as child pornography, were reported to different tip lines around the world, an increase of about 30% from 2020. Expression of estrogen-related gene can impact post-menopausal breast cancer risk. In a study using a first-of-its-kind mouse model of aging that mimics breast cancer development in estrogen receptor-positive post-menopausal women, investigators have determined that overexpression or switching on of the ESR1 gene could actually lead to the elevated risk of developing estrogen receptor-positive breast cancer in older women. In a second study from the same research lab, investigators found that in the specifically bred mice given anti-hormonal drugs similar to those currently used by the women to lower their breast cancer risk, the elevated risk of developing breast cancer due to the overexpression of the ESR1 could be lowered or even reversed. The findings that I'm talking about appeared in the American Journal of Pathology. Gantenerumab data presented at CTAD. The phase 3 trial results for lecanemab and gantenerumab presented at the Clinical Trials on Alzheimer's Disease, that is the CTAD conference, demonstrated why optimal treatment of Alzheimer's will require drugs that do more than clear amyloid plaques. While lecanemab had an effect on slowing the cognitive decline and removing these amyloid plaques in the brain, gantenerumab had neither effect. This was a historic clinical trial on Alzheimer's disease conference reflecting tremendous progress in Alzheimer's research and drug development. There has been a lot of encouraging news, including the lecanemab results and clinical trial data from other classes of drugs as well, that demonstrate the diversity of the pipeline in this treatment. So the mixed data shows that while anti-amyloids are a promising starting point, however, there will be need for a combination of drugs aimed at different targets. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.